The roots of dissociative identity disorder go back to early childhood development.
This is a disorder that has long history. One just doesn't come up with it. It's diagnosed generally in adult life, although I have had some children who I believe were working through or developing this disorder. It tends to happen as personality is forming. So we're talking about this occurring, or at least the seeds being planted prior to age 4. These people typically have large gaps in which they have no memory. I had one lady who would, for instance, be driving and an hour would pass. We call this losing time. Have no memory for that whole hour driving around town.
And here are some other identifying symptoms of DID.
I think a teacher or a classmate might just notice a person who's sort of spacey. They may also notice that the person has sometimes dramatic changes in the way they act or express themselves, maybe even the way they dress. They could be very outgoing and gregarious, wearing rather loud or flashy clothing, and then you see a person maybe the next day that's sort of withdrawn and mousy.
Dr. Milby is emphatic in pointing out that dissociative identity disorder is not a physical ailment.
Such as blackouts during alcohol intoxication, a general medical condition like a seizure, or some kind of dementia. Okay, so this is definitely a psychogenic and not an organic condition. It is thought that the driving force in these dissociative disorders is anxiety and an unwillingness to accept things that have happened.